once again. You know, one of the fourth global health threat is what we call vaccine hesitancy. This is now a terrorist we are dealing with in the vaccination world. There are many myths and misconceptions. Reason, let me start with our routine vaccines. People are no longer seeing polio cases, they're no longer seeing measles cases, so they will come up with any rumors, and then they will say, no, vaccines are really going to kill you, vaccines are going to do this. But even with the COVID-19, we've seen this really full-blown. Very many myths and misconceptions. But I would like to reassure the listeners that as long as the vaccine has met the requirements of the phases that I've really highlighted, from phase 0 to phase 3, has been reviewed independently by all these national regulatory authorities, which are equivalent to NDA, from all over the world, and they say yes, this vaccine meets. There are three main issues that are looked at before a vaccine is given. I will call it a certificate to be rolled out to millions and millions of people. The first one is safety. Safety is looked at all phases, as long as the vaccine is safe. And what the scientists look at, as I mentioned, vaccines are like drugs. Drugs cause side effects, but can the client handle that side effect? Yes. For how long can the client stay with this safety issue, the headache? 2 to 3 days, and will be done. Okay, how can we manage? You can give some Panadol, and the person will improve within 24 hours. So safety is the number one issue. Then the second one is quality. Where is this vaccine produced from? But even this team, which I'm talking about, they go and inspect where that vaccine is being produced, so the quality. And then the third one, Father mentioned, the efficacious. Is it able to produce the effect we're interested in? And here it is. Is it able to prevent the severe disease? Is it able to prevent dying from the disease? Yes. So once that product meets those three criteria, it's given a certificate. So those myths and misconceptions, we've tried as much as possible through, we have a pillar at the Ministry of Health, a communication pillar, which reviews all those all that information which comes in, and immediately information is sent back. And what also the ministry has done, and this is now the starting point. I'm not saying it's a starting point, the solidarity with the religious leaders. We are giving the right information so that the religious leaders can also go out and talk to the masses. Cultural leaders have been made. Now at the grassroots, we have the village health teams, okay? Those volunteers who are helping us, we've also given them information. The issue is to tell the community, first of all, what is expected to occur when you receive the side effect. We tell them, and they know this one will appear. But if there's anything which is unusual, please come back. Now what you need to know, the listeners, that for the COVID-19, we are targeting elderly, 50, 60, 70-year-old. Remember, that is an age group which is also prone to the other diseases Father was talking about, the diabetes, the hypertension. That could be maybe a time, when I give you this jab, maybe that is the time also God was planning, in quotes, that now also the hypertension will be coming up, okay? But not that the vaccine has caused what? The hypertension. We've had so many myths that people have died. We said, okay, who has died? But for us, we have a special team which is put in place. We go and investigate. We even do a post-mortem. And we say, okay, now, we've done a post-mortem. No, this client had the TB. And it's not that the vaccine has caused what? The TB. So there are many coincidental findings we've found. But the key message I would really want to raise now for the listeners, please, if you have any medical concern following vaccination, which is outside what we've told you, headaches, fevers, diarrhea, because there's a list which we've already communicated to our clients, don't stay at home just depending on rumors. Rush immediately to a health facility which is near you, so that thorough clinical care and management is provided. We've lost some clients because of malaria. They think it's the vaccine which has caused what? Fever, and yet that malaria could be what? Could be managed. So all those myths and misconceptions, please let people get information from the right technical people. We've equipped everyone, so they are ready to respond to all your questions. There are even hotlines at the Ministry of Health who will be ready to respond to the questions. You've been vaccinated. Have you died? We are waiting for the 2 years to come. Have we died? No. We are even going for the boosters. Yes, because now some of us are due for what? For boosters. We are going for a booster dose because the ministry has made that. And for the booster, it's because it's a new disease. So studies are still ongoing. And they've realized after 6 months, that army reduces in our body. And yet the COVID-19, that virus keeps on changing. We've heard about the new virus coming on board. So it keeps on changing. Get a booster so that you build another army that will be able to fight what? These new viruses that are coming on board. So COVID-19, we are still learning and we will continue learning. But any concern, please don't stay at home. Sending out social media, then spreading wrong rumors. Get the right facts from the right technical people. Even I remember when the Kabaka went for the jab, the Queen mentioned, I had several questions, but I read, and now I understood the benefits of what? Of vaccination. So that is the, get the right information before we can spread the rumors. Thank you.
Yes, this is the first pandemic in the history of the world which broke up in the area, the era of digital, the digital age. And this digital age has an overflow of information, and we are faced with a phenomenon which is called infodemics. Infodemics means that there's a lot of flow information. We don't, the sources, sometimes we're unable to establish where they're coming from, who's spreading them. We can't peer review that information, some of which is very good, and some of which is very, very dangerous to the people. And so, because of that, public health officials previously communicated to the public using the mainstream media. For example, like we are doing here, radio, newspapers. Then what happened is that during this time, anybody can communicate to anyone using the social, the social, I mean the other platforms. And it has become a problem because some of the information is not peer reviewed. And also, so we developed two phenomena. One of it is called misinformation. Misinformation occurs when there is a gap. The public health officials say, okay, we are going to vaccinate you, but since it is new, we are going to find out what are some of the after the events that, I mean, some of the effects that might happen afterwards. Then somebody, because there is a gap there, somebody fills in and says, yeah, you will become impotent. And then there is a phenomenon we call disinformation. Disinformation, somebody deliberately intends to misinform and creates something just to misinform. So the public health officials say, okay, COVID started in China, we are going to try to find out. And then somebody comes up and says, no, the Chinese manufactured it in a factory. And how do you manufacture? If you understand a virus is a living organism, one cell. And the only person who can create a living organism is God. How can the Chinese create? Are they gods? It is possible for them to be in the laboratory and then working with that, and then they mutate because they have the ability to mutate and infect the lab technician and then be able to transmit from person to person. But you can't create it. Yes, thank you.
Thank you very much. Maybe before I come to the strategies we could take, I just would like to add something on what Father has just said. Why I am doing what I'm doing is because of the background in the media. Because of that information, misinformation, people were so mixed up, and we had to take the responsibility of getting the right information and get the right platform, including even the social media, to give people what they ought to get. And I would say about the strategies or whether we should change or go the way we are going, I think there's nothing much we need to change, because I would say people trust the church so much so that we're actually riding on their trust. For example, one time a sister just made an announcement in the church. The whole crowd went following her for vaccination, and vaccines were finished, just as we observed. So what we are trying to appeal is to see if we can have enough for everybody. Yes. Otherwise, we're on the right track. Thank you very much.
Current 1 dose for the Johnson and Johnson. So those are the vaccines we have in the country. And the good news, in December last year, the Ministry of Health now approved the policy of even mixed matching. And I think you've heard about the mixed matching. Reason, you may be due for your second dose of AstraZeneca, but it's not available. But now WHO, using the data from the scientists, said no. If there's no AstraZeneca and you are due for your second dose, okay, to be fully vaccinated, but there's Pfizer, go and they give you what? Pfizer or Moderna. So now there should not be any excuse of someone not being fully vaccinated, because even the mixed matching has already been approved for both Sinopharm, AstraZeneca, and they, of course, Johnson & Johnson is just from only 1 dose. So whichever COVID-19 vaccine product is available, it is a good product. Many of the masses want Johnson & Johnson, and most likely it's because it's a 1 dose. We don't want to get disturbed. And know this, we are adults, we are working class. You want to just go and receive your 1 dose and then you go home. And don't want to have those reminders of now when am I due? Is it after 12 weeks, 8 weeks? So that's why even many people now, they want Johnson & Johnson. But I want to talk to our listeners this afternoon, that if you walk now to a vaccination service point, whichever COVID-19 vaccine product is available, please just accept that. Don't have preferences. Because you might walk out from that hospital, from that clinic, and then accidentally you get infected with the SARS-CoV-2 virus. What will happen? Now you will be admitted. Yet you missed your opportunity to receive whatever product is available. In December, the last speech by the Honorable Minister of Health, she made a statement that in January, we are planning for the polio campaign. And I think you must have noticed that. We've been doing a polio campaign, and it's the same health workers who are administering the COVID-19 vaccine and the same way administering what? The polio vaccine. So now the focus was on, so we had to put suspension on the COVID-19 for that period. But now as I speak, National Medical Stores has delivered, is starting to deliver the COVID-19 vaccines to all the districts. So if you go to a health facility, okay, which is offering vaccination, the vaccines are available. So now I would like to encourage all our clients, our community members who are due. You've never been vaccinated, please rush now. The vaccines are there. That is in all the districts. Now, effective tomorrow, we're doing campaigns, okay, accelerating, so that we give an opportunity to all the people in those specific regions. Now, Karamoja sub-region, the Bukedi-Bugishu sub-region, then we come to Busoga sub-region, and then the Greater Kampala, which has the Gomba, Butamba, of course the Buganda region. Now they're planning to do a campaign. Now what is the difference between the campaign and the other routine one? For the campaign, we've expanded the vaccination service points. We are bringing services closer to the people. But for the rest of the districts, you walk into any health facility which has our routine. I would say the one which has the measles vaccine, you should also be having the COVID-19 vaccine so that you can also receive your jab. For these other ones, from the 29th of this month, all a week later, for the Karamoja sub-region, they push it a week later. They are ready now to expand. So many teams are going to be set up closer to the communities, churches. They will use some open tree or LC's home, and then all these people will have to come and receive their jab. So the vaccines are available. As I speak now, the National Medical Store has the vaccines to reach the 22 million targeted population. Thank you.
Yes, I wanted to say, like the doctor said, all vaccines that have obtained WHO emergency approval, those used in Uganda, they're efficacious, and all of them prevent us from developing severe illness. So whichever one we get is efficacious. Two, the doctor has mentioned that many of the people who are in the hospitals with a severe illness are those who are not vaccinated. And that's the fact. And it's three, among the most risk populations that were identified by government are the elderly and those with comorbidities who have some underlying conditions. And uptake of vaccines is very low among that group. For example, the elderly, the targeted population was 3 million, and only 40.5% have received the first dose, and only 6.2 have received the second dose. Among those with comorbidities, government targeted 500,000, but among those, only 90.8% have been vaccinated. And what does that say to us? Those with comorbidities rely upon us to take them to vaccine centers. And also, sometimes there are people who deceive them. They say you have a comorbidity, they will put a vaccine in you and you will die, which is absolutely not true. And so I would encourage people, please, help those people with comorbidities, underlying conditions who are at home to get vaccinated. And we encourage those who are 50 and above, please get vaccinated. Thank you very much.
Thank you very much. And just to add on before you come, especially those with comorbidities, the pre-existing, let me just use a very good example, hypertension, high BP. Please continue taking your medication, even if you receive the vaccine. Don't stop taking your medication. Because there's that myth, no, these drugs will interact with the vaccine. No, please continue taking your medication. We've had cases that have a severe headache, when you measure the blood pressure, it is too high. It's because he stopped taking what? 30 seconds. COVID-19 is a new disease and a lot of information is being gathered through research. So we are telling you now the new variants booster doses. Tomorrow, don't get surprises when we come with some new information. It's because science is still going on. Now, my last comment, it is now an individual responsibility. There's no shortcut. The economy is fully open. It's up to you to follow the 4 principles. Get fully vaccinated. Go for your booster if you're due. Avoid crowds. Okay, but if you happen to go to a crowd, use your mask and your mask very well, and above it all, hand washing. Avoid touching the soft parts, as His Excellency has been telling us. It's now an individual responsibility. Thank you very much.
Yeah, thank you very much. Solidarity, let us work on solidarity. Solidarity means personal responsibility and social support. And let us, as religious, we have that responsibility to work with the government and other stakeholders to ensure that we achieve the good, the common good, the well-being of all. And also would encourage those districts who have low uptake. For example, Bugisu, Karamoja, and Busoga have 18% uptake, and Bukedi has only 11% uptake in vaccine uptake. So we encourage you, please, go ahead and be vaccinated. Thank you very much.
His medication. Thank you.